Hi, everybody. Welcome to the first Life Course Centre seminar of the year. Let me start by acknowledging the traditional owners of the lands on which we're meeting right across the country and pay my respects to elders past and present and recognise their continuing cultural and spiritual connections to country. I'm coming to you from the land of the Yagara and Turrbal people. Really pleased to welcome our guest speaker today, Kayelle Drinkwater from Department of Social Services. And Kayelle's going to talk to us about the National Disability Data Asset. And this is a really exciting new data resource that's coming on board that DSS is leading, and the data set that is now available, which is very exciting. So the purpose of today is really to tell you about the data set. So Kayelle is a data branch manager in the Department of Social Services, one of our key partners in the Life Course Centre, and she's leading the National Disability Data Asset Project. She's previously been responsible for all income support reporting, and she was nominated for an APS Data Leadership Award. Prior to joining the DSS, Kayelle was the Chief Data Officer for the Department of Industry, Science and Resources. And she's also previously been a Senior Executive Service Officer in the Department of Finance. Kayelle holds a master's degree in Health and Information Technology. So sounds like data is all over your history, Kayelle, and that will speak to many people in the Life Course Centre. So thank you very much, Kayelle. This is really great timing as we start the new year. We're looking forward to hearing about the data.
Thanks very much, Janine. Can I too acknowledge the traditional owners and their custodianship of the lands on which we meet today, pay my respects to their ancestors and descendants. I'm coming from Ngunnawal country today in the ACT. So the National Disability Data Asset is an integrated data asset, and many of you will be familiar with PLIDA, or MADP as it was formerly known. It really differs from PLIDA in that it has more state and territory data in it and data sets that have not been shared before. So I feel like a sort of miner and developer when I say they're greenfields data sets. And of course, as you would all know, there's a lot of work in working with data custodians and for people to understand how to share data. So this project came about through a disability pilot, which was across several of the jurisdictions and the Commonwealth. And the sorts of questions we're wanting to answer is things like, when somebody goes to a hospital emergency department, is that admission relating to their disability, or is it relating to something else? They've broken their arm, some other type of illness that might need an emergency treatment. And it sounds very last century to be able to say we can't quite work that out yet, because our data doesn't actually enable us to link all of that together and get that more meaningful data. So that's the sort of 20-second view of it. We'll just go through these slides and to sort of describe the data itself, and also how we're working with the disability community and what it is and isn't doing for us. Just get rid of my meeting chat if I can. Not quite. So it brings together almost every domain, subject matter domain. So disability, health, social security, education, employment, and so on. It's a key initiative under the Australia's Disability Strategy, and it is co-governed with the disability community. And I think that is one of the things that fundamentally sets it apart. So when researchers are putting forward project proposals, we'll actually go through an ethical oversight group that has people with a disability on it. So it's really got that user design right from the get-go. We're interested in improving outcomes for people with a disability. It's a whole of population. So obviously having a counterfactual group of both people with a disability and the same cohort without a disability gives the counterfactual analysis available to researchers. It's really the first time we have scaled to this level. I joke with my team and my lawyers where I say it's over 200 datasets and 200 lawyers. It's also the first time the Data Availability and Transparency Act is being used. And I think that's a great safety mechanism and provides a really solid level of comfort to the disability community. I'm going to say it isn't perfect, but again, we'll work through the slides and tell you a bit about that as well. And if you're not already accredited, how to get accredited. So the first three focus areas are under the disability strategy is around health outcomes, employment outcomes. We have also developed the first generation of disability indicators. So again, in the different domains, people describe disability in different ways. And the one that I still find a little bit surprising, really because my expertise is in data, not actually disability, is that the education departments, plural, and schools sort of notify that or flag when someone has a disability when they've made an educational adjustment for them, as opposed to they might have something that doesn't need an adjustment for them, but they still actually have a disability. So we're not capturing and recording all of the people that potentially have a disability. So, is the data correct? You would naturally ask. So it's, that's an important part of what we do as well. Thank you. So it's a $68.3 million investment. And there's really two streams to the work. One is the Australian National Data Integration Infrastructure. So this is about the national spine and linkage and the ICT that sits underneath to support it in the ABS and AIHW environments. Those of you working in PLIDA will be familiar with the Seed Pod and Data Lab, and it'll be sitting alongside those. And then the NDDA itself is around the data sets and working with the disability community. So the co-governance, there's the NDDA Charter, which lists principles and guides how the data can be used, so acceptable and unacceptable uses. And this is oversighted by our NDDA Council, which consists of people with a disability, researchers with specialist knowledge, either on priority areas or disability or data or both. So it's quite an impressive group of people, and I've been fortunate enough to sit in on that a couple of times for Gemma Van Helderen, and it never ceases to amaze me, their depth of knowledge about this type of work. It's very impressive. And this is really how we like to think about the data. So before, in the very different domains, we call people different, use different terms depending on the domain. There could be a tenant, a student, a patient, a defendant, an offender, a parent, a child. Whereas we're actually interested in the person as a whole. And so when we link all of these together, it's like putting the pieces in the puzzle. So there's multiple aspects. I'm sure you will all be aware of, socioeconomic determinants of health, which make that linkage just so vital in how we support, potentially very vulnerable people. Thanks. So here's some key benefits that are coming out of the project. We've got shared decision making and improved outcomes through our insights with the disability community. Researchers, actually, many of you will know, that the data quality around people with a disability is not as good as it could be. And having that sort of data uplift is important to getting the insights. data linkage efficiencies for states and territory governments. So again, when we haven't, not everybody links data in the same way, and having some of that a bit more efficient in the system is super important, and also will lead the jurisdictions to other insights in their own jurisdiction. And of course, the disability strategy requires that data uplift and reporting to support services and programs for people with a disability. And so data safety is one of course, our key underlying principles. And this is really around the 5 safes. So safe projects, safe people, safe settings, safe data, and safe outputs. We'll be happy to share the slides afterwards for distribution to the people on the call. So don't worry about trying to capture all of that information in one go. Thanks. And as I mentioned in the charter, we have acceptable uses and unacceptable uses. So this is really about growing the evidence base so we can have better understanding for people with a disability, their families and carers, and help get benefits for them. We want to, develop international disability standards through this work and share our insights. We want better evaluation for programs to get those improved outcomes. And we want to understand people's experience so that we can support the policy and development and service provision. But what it can't be used for is it can't identify any people in the data set. Now, it is a whole of population data set. So if you think of about 28 million individual records, that's quite sizable, but we don't want anybody to be recognised in any of the cohort work. It can't be used to make decisions about government funding for an individual access, and it can't conflict with human rights approach or privacy laws, can't be used in automated decision-making tools, and it can't be used to determine funding agreements between the Australian state and territory governments. I think they're all pretty self-explanatory. Don't do them. So here's the data we've got planned for release in 2025. Child protection. There's just a few examples here. Personal income tax, hospitals records, aged care, housing and homelessness, employment services, school students with a disability. And then I'm hoping we've got the Wheel of Fortune in here that I like to call it. So this kind of outlines to you the breadth of the data sets, I guess. Now, one thing I would say is when you're looking at each of these later, think about that multiplied by every state and territory. Think about that all the states and territories have different privacy arrangements and legislative arrangements for sharing their data. So whilst we can talk about, admitted patient care, the data set itself and the sorts of fields it contains might be the same, but there is 8 different negotiations to go through to actually get it in, and they don't all come in at the same time. So 2 that I'll just call out there is the housing and homelessness and the justice. They're not in PLIDA. And the other, another one that we've been able to successfully put in is for the NDIS. It includes both applicants and recipients. So if somebody applied to the NDIS and was unsuccessful, we are now also capturing that data. And that, I think, makes for a very interesting cohort, particularly around works in foundational support that'll be coming online later. Thanks, Sylvia. And so in release 1, we had a range of data sets, so Commonwealth, state and territory, and we developed a range of products. Now, they're not all sort of publicly available, but I guess, those of you working with this type of integrated data would be aware of there's a lot of steps you need to take to get something out at the final final pass. So there's the first 12 deliverables that we've completed now. So one of the conditions of use of the NDDA is that an organisation is accredited as a data user. So that at the moment, that means a Commonwealth, state or territory government or an Australian university applies to the Office of the National Data Commissioner to be an accredited user. And I think all of the universities represented here today are an accredited user. So that's a big step forward. We are getting applications from people who aren't accredited. And of course, our first step in that journey is about education to become accredited. So users need to be able to demonstrate their competencies and safe practices in handling and using data, which I'm sure you're all very familiar with. Here is a little schema of the data availability and transparency scheme, which outlines the sort of the key processes, if you like, and who's who around how it works. So there's accredited users. There's also accredited data service providers. So DSS is both an accredited user and an accredited data service provider. My role is also a data custodian role, where I look after the Domino, which is the longitudinal data set for social security. So at different times you get to play different roles, but it's still all about that data governance, hygiene, and integration. So what we've been doing is working with some of the researchers about identifying suitable topics and working with them to, if you like, scope them up so that they can be then formally lodged and applied for. Obviously, the project needs to be around people with a disability, not, other things, even though it does capture a lot of other information. So here's some, a couple of examples. Obviously, we want to try and get as many different examples and use cases as we have. Not everybody's interested in the same thing. So primary and specialist care, how is that different for people who the cohort where we've got indicators of a disability, and how does that compare with NDIS participants compared to non-NDIS participants, and also the health service use by location and type. Again, people with indicators of a disability and people without. And then again, and some of this work, I think, through COVID was quite interesting to track mortality and chronic health conditions. And, this is taking it another step forward with people with a disability about, rates of suicide, homicide and accidental deaths for people with indicators of a disability. So we have all the deaths data from every state and territory, also in the asset, and incidents of selected indicators of common chronic conditions, again, people with a disability and people without. So it's quite interesting to see the different lenses that the researchers are interested in applying. We've got a few PhD students in there as well. So again, if you're supervising or, we want to encourage use of the asset. So please, feel free to reach out to us afterwards so we can connect you with the right team members. Insights relevant to foundational supports. This is, obviously for the jurisdictions, the foundational supports is big. But using this health service by location and the types, my screen's quite tiny, but you can probably see all the graphs a lot better than I can at the moment. I think that just gives us a richer picture. And of course, you know, you can gain a lot more utility by having a richer picture about what's going on. Disability indicators we're just in the first generation now. And as each time goes on, we'll be adding more and more of those. So people will be able to get, you know, larger cohorts or focus in on different types of disabilities. Thanks. And here's a couple of mixed method examples for you. Again, these are to stimulate conversations and idea formation, not, you know, people have to all fall within these. So again, this is access to health services and healthcare utilisation. And we've just framed this around disability research partner could conduct research on access to health services and gaps. So, you know, gaps is just as important about what people are consuming and how is that linking to health outcomes, including things like avoidable hospitalisations. And if you've got a few thought bubbles and they occur to you, please feel free to type it in the chat, because we've got DSS colleagues online, but also we've got ABS online with us as well, who is managing some of those project proposals. So please feel free to just drop things into the chat. Another example here is medical cost burden. And again, around healthcare utilisation, out-of-pocket expenses, you know, things like that can, you know, have a large effect on people who have either chronic illness or a disability. And here is a little journey map for you. So this is when there's a project proposal or when it's being worked up, you know, some of the considerations that the project applies. And that is, does it meet the acceptable use checks? Tick, great. What are its benefits, and are there any harms? Checks. And this is where we get to some of the ethics approvals and ethical oversight. So we've got a disability-informed ethical oversight panel, and the first two projects are going through that panel this week. So that's very exciting for us to say that this project will not cause harm to the participants, which is obviously part of the Charter and our commitment to co-governance with the disability community. Great question in here. I am no expert in disability sector by any means, but rather work in mental health. How much detail goes to the data into the terms of the disability diagnosis? Excellent question. I am going to start answering that for you. I will, I know you went by any means. I will also throw open to Jenny Mitchell from the ABS, who can also add, and if Philip wants to add anything else there as well, please feel free to do so. So in the work with my data set, Domino, we have, for people on disability support payments, we actually have quite a detailed itemization of a number of diagnoses. So when someone meets sort of impairment tables that might be relating to one disability, but it also might, so we might go primary disability, we then might go secondary disability. And in other cases, we might have 5 different types of chronic conditions that are against, I'm just going to say, a particular individual, or cohorts of individuals, and in aggregate, those can contribute to their disability diagnosis. So it's quite, and we've done quite a lot of work on this to make sure that we are capturing just not that primary headline issue of what their primary diagnosis is, because that might not be the thing that we need to focus on. So Jenny, can I just throw to you? Do you want to add anything there onto that?
Yeah, so I think it's really worthwhile having a quick chat about what we call the disability indicators module. So Philip can talk a bit more around the governance. There is a panel that are overseeing the kind of method that goes into this particular module. It's one of the big value adds of the NDDA, and the purpose of that module is to give all researchers, so any researcher working across any NDDA project who's approved to have access to this module, to give them those kind of consistent definitions and consistent population scoping flags for identifying people with disability and the kind of characteristics of that disability. So it's still, as with many things in the NDDA, what we have at the moment is the initial version of that module, which pulls together the data Kayelle has mentioned from Domino, so that sort of Centrelink payments welfare type view for people receiving payments and carers payments, I believe, and also pulls on data from the NDIS, so where people have an NDIS package. Philip is probably more across the specifics of that, but we're working with the panel to ensure that the methodology that goes into building that module is one that's endorsed by the disability community, and that we have a bit of a plan for how to continue to improve that over time. So what other data can we bring into the asset to improve those disability flags, and how can we support various researchers to use that module in the best possible way across all of their research projects, so we're getting that sort of nice consistency across various different research organisations. Philip, did you want to add more on that?
Yeah, I'd just like to clarify just in terms of the disability indicator at this stage. As Jenny mentioned, it is kind of based on what supports people are receiving. So sort of in terms of the actual question talking about diagnosis, very much it doesn't have sort of a diagnosis sort of lens at the moment. It's more based on what sort of support payments people kind of are receiving. But as Jenny mentioned, the disability indicator, this is just stage one of the disability indicator, and we hope it will improve over time, and we'll bring together more of the data sets that will be in the NDDA, and have, as Jenny mentioned, a bit more flags of that can give you more information about people's disability.
Yeah, so anything coming from Domino that has a disability category does flow through to the data, as does anything in NDIS. We've got a good question here from the NDIS package. What I'm going to do is just ask Tim to answer that one online so I don't run over time. But yes, if you keep dropping questions in there, we can just also type a quick answer back to you as well. So thank you. Thanks, Philip. Thanks, Jenny. So we've got, checks about you're an accredited user, you're going to be safe and trusted to do this. There's some onboarding and obviously a data sharing agreement for, once you've gone through the stages of working up your proposal. There's some training available as well, so partly working with the data, but also making sure that in your research proposals that the outputs are also accessible. So that is part of doing this work, that these research comes back in accessible formats. So again, there's some materials being set up for those. Of course, there is some vetting on the results, and in much the same way there is for PLIDA. And as you can see there in those steps, there's a summary, there's accessible translation, and then the results get published. So there's a few extra steps, I think, in the NDDA because of the nature of the work, but I think the value that can give to researchers and the disability community is, it's just amazing. And it's really great to work on it. So here's another little journey map about testing findings. I won't read through the whole slide, but again, you know, it's important with the disability community that we test people's findings and obviously make sure that nobody is identifiable through the projects that we do. And we've got a quick question in there. Similar to NDIS, do you also have information on DSP applicants? Yes, we do. The disability support payment comes from DSS. So that comes in my data set, the domino. So yes, that will be included. First release includes all NDIS data shared into Plida as well as some data on applicants. Thank you. And Tim's just chatting away there, so I think that's all working. So I just want to give you some contact details directly, so that if you're interested in talking about project proposals or you've got a more general question about the NDDA, we can get you to reach out to the right group so we can answer your questions as fast as possible. So Philip and Philip's in the NDDA at dds.gov.au. So this is when we're talking about the councils, panels and community engagement. That's the place to go. If you're asking general questions about data sets, that's with Tim Silver and myself. That's the NDDA policy team. And if you are talking about the disability indicators, it'd be good to reach out to the Australian Institute of Health and Welfare. They're leading that work with DSS. And then if you've got actually questions about the data infrastructure or accessing it or a project proposal, it'd be great if you'd like to go to ndda@abs.gov.au. A quick question here, how do we identify who are the institutional contacts are for each university? I might just need a slight clarification there. Does that mean about whether your institution's accredited, or does it mean about somebody who's already put in a project proposal?
So the accreditation's handled by the Office of the National Data Commissioner, and they have a publicly available register which lists out all of the entities who've been accredited. So if you go to that register and look up your organisation, it should have either a contact person or like a group email kind of contact information for who your organisation's accredited entity is. My team, if you contact that NDDA at ABS email address, my team are kind of the front door for research projects. And so we often, if not always, in those meetings, make sure that any interested researchers have been in touch with their organisation's accredited officer, because that accredited officer is the person who would sign your data sharing agreement with the ABS. So yeah, very worth having a look at that register and having a conversation with your organisation's accredited officer. If you're interested in accessing the data, there might be some additional things that your university wants you to do before you apply.
Yeah, that's a great question. Thank you.
I'm pretty certain that all of the nodes, and Jen, you're at University of Sydney, I think all 4 universities involved in the Life Course Centre are accredited. So UQ, UWA, Melbourne and Sydney, but yeah, worth double checking.
We've got a question around employment data, as I'm going to call it very loosely. So we do have disability employment services data, some of it there, and then over time we're going to be building that employment data out. So that's something my new secretary, Michael Lai, is very keen on. And, you know, it's really super important aspect. And Philip's just kindly put a couple of links in there as well about measuring. We've got a few fact sheets on the NDDA website So we've got measuring disability and our disability indicators explanatory notes. So again, that can help you think about your proposals. Yeah, great. And so then we've got Heidi on the mental health. So it's quite interesting in the disability support payments that the number one diagnosis is actually psychological conditions, whereas often I think people's perceptions is it might be something else. So that is captured. Where we have it captured in Domino, where mental health is captured, we do have that in there. And again, because of an interplay there with the disability, there is a project proposal sort of coming through that is focused on intellectual disability. And I'm not actually across the details of the project, but I'm assuming you are thinking about mental health as being more psychological issues rather than intellectual disability. So I think, again, we've launched the first data release, and it did take us a while to get there. It is quite complex negotiating data sharing agreements on this sort of scale, but over time, as we keep adding, more and more things will be there. And we know that people's mental health, affects their ability to have economic independence through a job. It affects their opportunities in life, and they are more likely to consume more health services or social security services. So obviously that's just one aspect.
There was a question there about what years the data cover. I think Tim's just answered that.
Yeah.
Yes.
I can't quite. It's many and varied, I think, is the short answer. So it does depend on the data set. So some of them go back for 30 years. The one on the two of the census ones, community surveys, they just have 2 years in them because it's a new survey. They've only been undertaken twice. I can't quite see Tim's answer there, but we do have a very comprehensive set of documentation that says this data set goes from this period to that period. And of course, there's the refreshing of the data as well. So, as another survey occurs, that will be added in, as well as the regular kind of, I'm going to say, the normal updates we do. So DSS updates, the ABS and AIHW quarterly.
And we can certainly share more detail if people are interested in particular data sources.
Data sets,
we can let people know exactly which ones have exactly which years of data at the moment.
Yeah.
And variable lists if need be too.
I might just ask Jenny on the restriction to a particular cohort. So I'm going to say e.g. birth cohorts. So Sarah, thanks, great question. I think that will come out in the research proposals, project proposals. So often people are looking for a particular cohort. That doesn't mean you'll get open data access to everything. Rather than, your project proposal, what do you need to make it successful? Jenny, do you have a cohort answer there on your specifics?
I do. Yes. So in the same way that that all of the data in the asset is population level, it's also all longitudinal. So the way we prepare the data is in what we call modules. And in most cases, a single data set would have a single module. And that module would include all of the variables that exist for that data and all of the years and all of the people. So we don't create custom data sets for each approved project. We package the data up into modules, and then you're approved to access the entire module. So we don't scope particular populations in the data that we give you, but within the scope of your project, it's perfectly acceptable for you to scope your own population down to whatever population of interest you require. So it's a bit of a difference. If you're used to working in the PHRN kind of world, where the data set you're given is sort of a custom table that's been pre-scoped to just the variables and just the population you need, the NDDA model is quite different. It's much more aligned with PLIDA and how the PLIDA asset works. If there's a reason for us to separate out particular variables or populations, if they're particularly sensitive in some reason, in some way, we might separate them out. But in most cases, if you're approved for, say, Domino, you'll get the full scope of the population, and you'll get all of the years of data for Domino.
So I think the scoping of the cohort is at the researcher's project proposal, not we say, you're interested in 7-year-olds, we're giving you all 7-year-olds.
That's right. Yes, we give the full population, and then if you're just interested in 7-year-olds, that's great. You can scope it down, or you've got the population there, so you can do comparisons then to your 7-year-olds and other cohorts if that's in scope of your project.
So I had a couple of process questions, Kayelle. So just there was a slide there saying the suggested process, but just for instance, say there's a couple of researchers here in the Life Course Centre who have a project idea, and we have processes that we would need to go through in terms of getting approval from the centre. But what would be step one? Would they approach DSS? Would they approach AHW or ABS, or would they just shoot an email to that policy, DSS policy group to say, here's our idea, how do we progress it? You know,
great, awesome. Love that question. So we do have the no wrong door policy. So if anybody comes to any of those, you will end up in the right place. We're really keen, and it's Jenny's team that leads this part of the work, to work with project ideas or interested parties before you get to the formal lodging stage, so we can make sure that it's a bit smoother when you lodge. So things like, are you accredited? You know, what's your interest? Do we have all of that data in right now, or is that one that will be, you know, later in terms of, so that, you know, we don't waste your time or our time. So Jenny, where people can just reach out to nddaabs.gov.au, but if you go to any of them, we will make sure you land with Jenny's team.
Great, thank you.
So that's actually step number one.
So I was going to say, just I know in the university space, often the first step for you will be grant submissions. So we're very happy to talk to people prior to submitting a grant application. We've provided a letter of support for one researcher coming through the pipeline who's applying for an MRFF grant, for example. So really happy to have those conversations with you in the early stages. And if there are things we can do to sort of support your project to be successful, we're very happy to do that. Similarly, with if you need to be seeking accreditation and that sort of thing, we're happy to be a bit of a conduit through to some of those processes as well. So no wrong front door and no wrong timing. Contact us anytime.
One other question, as more people become aware of the data, there'll be proposals, I'm sure, being developed all over the place. Is there a kind of a community of practice or a group of you know, people that we can kind of link up to say, what are you doing? How could we work together? Or also just to make sure that we're not duplicating what someone else is doing, because, you know, there's over 200 people in the Life Course Centre, and so there could be, you know, 150 ideas. And maybe
Yay!
what we're thinking of is already being done, or it's not a priority. How do we kind of find
Right.
out that kind of information as we're thinking about project ideas?
The first answer is the formal projects that have been submitted are on DataPlace on the Office of the
Okay.
National Data Commissioner, visible for the whole world to see. So that's, you know, the formal people who have gone through the steps, obviously. And then the other part is, Jenny, I don't want to call you a data broker, but you know,
That's
at the
okay.
moment,
I call myself that sometimes.
excellent with non-government organisations, they're not able to be an accredited data user at the moment, and so what we're wanting to do with them is actually encourage them to partner with accredited universities. And this is where I call Jenny the data broker, because part of Jenny's role is to actually help that process
I
along.
was going to say the other thing is we are intending to stand up a community of practice. So with the NDDA project, we have a group called the Central Analytics Team. So that includes researchers from ABS and AHW and DSS who'll be using the data. But we're hoping once we have a few active projects and some active users to stand up a community of practice for exactly this purpose. So for active researchers and those who are potentially interested but not quite active yet, to have a bit of a forum for them to share tips and tricks on how to use the data, and to collaborate on ideas. So that is on our work program. We're just in the early stages of talking about how to set that up. So it will be coming, and very happy to extend an invitation out to anyone in the Life Course Centre who's interested in joining that community of practice.
I note that there's a disability ethics procedure that you'll go through at your end, or once the proposal's submitted. I presume that doesn't mean that, you know, in addition to that, we would also need to go through a normal ethics process at our university. And I just wonder the timing of that. Do we go through the NDDA ethics and then get that approval, which we then attach to our ethics, or what would you advise there?
So I would suggest doing the university ethics approval, so that HREC, as early as possible. The panel that we've stood up, even though it's got ethics panel in the name of it, it's not an HREC panel. It's not a formal ethics panel. So they're reviewing the project from a disability perspective to ensure that there's not a risk of doing harm to people with a disability. Absolutely unintended risk, I'm sure, but they are interested in knowing if projects have already received an HREC approval. But again, it's sort of, there's no wrong timing. If it's easier for you to get your HREC, having already had that disability oversight, we could do things that way as well. But I think I would, in most cases, recommend progressing with the HREC, and then when you submit formally to have your project approved through our processes, that ethical oversight panel would be informed that this project have already been issued an HREC approval.
A couple of questions that have come in. One from Francis.
Around just the difference in approach between you know, what's going on with NDDA and PLIDA, but specific to NDDA, and compared with other uses of these sort of state-based data assets which go through PHRN, which AIHW are a member of PHRN, where they have a different approach to supplying data, where you have to select the variables that you're going to use that are directly related to your ethically approved research hypothesis. In this case, your project is approved, but you have access to all the data. And so I just wanted to check what kind of safeguards or guardrails are in place to prevent people from then taking the data and going essentially on a fishing expedition or doing things that are outside of the I guess the main hypothesis that they'd put forward as part of their ethics approval.
It's a really good question, and it's one I think that shows a lot of kind of maturity, which is really a positive thing from our perspective, because there is a trust element at play here. So when we think about managing access to this type of data or sharing data in this way, we lean really heavily on that 5 safes framework. So the PHRN process invests a lot more or scales up the safe data control. So in the context of the approved project, the researcher only ever gets access to the data that's required, and the framework that we have in place is leaning much more heavily on safe outputs, safe people, and safe settings. So the access and use is always in an IT environment that we control. So we don't give copies of the data to anyone. They have it in an environment which is kind of monitored quite heavily and is very secure. In the safe people space, and this is where there is a trust element, we lean heavily on the accreditation. It's not an accreditation that is necessarily open to everybody. It's an accreditation that you have to have a level of trust and maturity to be able to get. And at the individual level, we onboard those researchers. So there's some mandatory training that they have to do, and they have to sign undertakings that they won't try to identify people in the data or use the data outside of their approved project. But the really big one that I think particularly our data custodians find reassuring is that when we talk about safe outputs, we're not just making sure those outputs don't include disclosive information, that they're not, unit record personal data leaving the environment. We make sure that the outputs are aligned with the approved project. So even if a researcher does kind of go rogue, if they have a project that's approved for, say, looking at hospital admissions for children with intellectual disability, and they're trying to have us release a bunch of outputs that are about income for adults receiving welfare payments, something that's completely obviously unrelated, those outputs would not be released. They would not be permitted, and we would become very suspicious about what that person is doing. We would look back at the logs, we cross-check back to the project. So there are a lot of checks and balances in place, but perhaps just in slightly different places to what you'd be used to.
There is 2 other mechanisms. So one thing with accreditation is accreditation can also be removed. So if somebody was doing the wrong thing, then they would be jeopardizing their institution's accreditation, which presumably would then flow on to other researchers. So I'm sure everybody's going to do the right thing in that regard. And also under the Data Act and the data sharing agreements, there are procedures in there for people doing the wrong thing.
Yeah, look, this is very helpful. I'm not suggesting that we're not malicious, 99.99% of us, but I also know that researchers are very curious, and they're in the data, and you spot something. Ooh,
That looks
actually,
interesting.
I've just put and before you know it, someone strayed a bit too far from what they were originally approved for, and I just wanted to check if there's something in place, something systematic that can stop that, and maybe send an alert or whatever.
Show it. Yeah.
Cheers. Thank you.
A final question from Letitia about how we can find out more about that community of practice that you're planning to set up, Kayelle.
Great. Yes. I'll need to call on Jenny because she's leading that part of it. I'm certainly happy to keep the life course data up to date on our work. But Jenny, over to you.
Yes, this one's a bit of I was a bit, I might have been a bit excited talking about the community of practice, given we haven't stood it up quite yet. But I'm very happy for you to put that as an action on me to come back to the Life Course Centre with an invitation to the community of practice and a bit more information about it over the next month or two as we progress that piece of work. So watch this space, but I promise I won't forget about it.
That would be great, Jenny. I think there'll be a number of people across the centre who might like to be involved in that, and it would be a great way of sharing information. So thank you. We'll follow up on that if we don't hear from you in a couple of months about it. Just want to thank you again, Kayelle, and all of your team in DSS, ABS and AHW. It sounds like a really exciting data set, and I'm sure there'll be interest in the Life Course Centre, and yeah, I really appreciate you taking the time to tell us about it. That's really very helpful. So thank you, everybody. Thanks for everyone coming to the seminar, and look forward to talking to colleagues more about possible projects going forward.